future nurses. All right, let's talk about the 2026 Next Gen NCLEX. We're going to dive into the two parts of the exam that cause the most stress for pretty much everyone, the unfolding case study and that tricky bow tie question. By the end of this, I promise you'll have a clear, solid strategy to turn that anxiety into some serious confidence. So let's get right into it. First things first, we've got to get our mindset right. The NGN is not about how much you can cram the night before. It's really a performance exam. It's designed to answer one single fundamental question. When you're faced with a messy, complex patient situation, can you think critically? And most importantly, can you act safely? And this is the most crucial point. The old NCLEX, it rewarded memorization. The NGN rewards your reasoning. It's not about just spitting back facts. It's about connecting the dots between those facts to paint a full clinical picture. Honestly, getting this shift is everything. So how in the world do you learn to think like a nurse for this exam? Well, you master the framework that every single question is built on. It's called the Clinical Judgment Measurement Model, or CJMM. This is literally the blueprint for the entire test. I want you to think of these 6 steps as your new nursing process, but specifically for the exam. Recognize cues is basically your assessment. Analyze cues is you figuring out what those cues actually mean. Prioritize hypotheses is all about deciding on the most urgent problem right now. Generate solutions and take action, that's your planning and implementation. And evaluate outcomes is, well, it's checking to see if what you did actually worked. Every single question you face is going to test one of these skills. Okay, now let's apply that model to our first big challenge, the unfolding case study. This is where the NGN really comes alive, right? It moves beyond a simple multiple choice question into a really dynamic scenario. An unfolding case study is really just a mini patient story. You'll get an initial report, and then you'll answer a series of 6 questions about it. But here's the twist. With each question, new data might pop up. Lab results, a change in vitals, new symptoms. It's all designed to feel like you're actually managing a patient over a few hours on a shift. So here's our patient, an older adult, respiratory complaint. Right away, your brain should switch into that recognize cues mode. What matters here? The age, the core symptom, and the timeline. How long it's been going on. And boom, the case unfolds. We get new, absolutely critical information. Confusion? That's altered mental status, a huge red flag. Using accessory muscles? That means serious respiratory distress. And that consolidation with high white blood cells? That just screams infection, probably pneumonia. See how the picture is getting so much clearer? So a typical question might look just like this. It's asking you to prioritize. Based on all that data, what are the most urgent things you need to jump on? Is it the confusion, the way they're breathing, the labs? This is testing your ability to go from just recognizing cues to actually prioritizing your actions. And the answer here? It's that new confusion, the accessory muscle use, and you'd expect a low oxygen saturation to go along with this. Those are your immediate threats. So how do you master these things? Well, first, always get the full picture. Read everything before you even think about answering, and look for trends. A single heart rate of 110 might be okay, but a heart rate that's climbed from 80 to 110 in an hour, that's a story. You've got to filter out the noise. And remember, while the case is all connected, each question is scored on its own. So don't let your answer to question 2 mess up your answer for question 4. Okay, let's switch gears to the other big one, the bow tie question. I know this one looks so intimidating on the screen, but it's actually one of the most logical question types once you finally understand its structure. Think of the bow tie as a 3-part puzzle you solve with drag and drop. On the left side, you'll pick the 2 most critical actions you need to take for this patient right now. These are your immediate, can't wait interventions. Then, right in the center of that bow tie, you place the single most likely condition or complication your patient is having. This is your number 1 hypothesis, the absolute core of the whole problem. And finally, over on the right side, you'll choose the 2 most important things to monitor. This is how you're going to evaluate if the actions you took on the left are actually working. See, it connects everything back to the patient's outcome. Now this slide right here, this is the secret sauce for solving bow ties efficiently. Don't start on the left or the right, start right in the middle. If you can correctly identify that central condition, I'm telling you, choosing the right actions and monitoring parameters becomes so much easier. And this example shows it perfectly. Let's say the patient's data, a butterfly rash, joint pain, a positive ANA test is all just screaming lupus. So you drag systemic lupus erythematosus to the center. Now it's easy. What do you do for an SLE flare-up that's hitting the kidneys? You give corticosteroids to calm down the inflammation, and you assess their renal function. And how do you monitor that? You watch the BUN and creatinine levels like a hawk, and you check their skin integrity. See how it all just flows logically right from the center? So, we've decoded the question types, but now, how do you actually prepare? Just understanding the format is not enough. You need a solid, concrete plan to build up that clinical judgment muscle you'll need to pass. Here is a simple but super effective weekly strategy. First, you have to live and breathe that CJMM framework. Use question banks that are specifically for the NGN. This is critical. Set aside time every single week to do full timed case studies. And here's a pro tip. Think aloud. When you're practicing, actually say your reasoning out loud. Verbalizing your thought process builds stronger pathways in your brain and makes your reasoning so much faster on test day. And don't just practice randomly. You need to focus your energy on the big ones, high-yield, high-acuity scenarios that test multiple CJM skills all at once. Things like sepsis, heart failure, DKA, and major post-op complications are classic NGN territory. Why? Because they demand complex clinical judgment. If you can master these, you'll be prepared for pretty much anything the test throws at you. As we wrap this up, I want to leave you with this one thought. So many students are terrified that the NCLEX is just full of trick questions. It's not. The questions are definitely complex, but they are not tricky. They're designed to give you a chance to show off your clinical reasoning. So trust the process, trust your education, and most of all, trust your ability to think. So here's the final takeaway. Clinical judgment isn't some gift you're born with, it's a skill. And just like any skill, it gets stronger with focused practice. The real question isn't whether you're ready for the NGN at this very moment, but what are you going to do today to start training? Thanks so much for watching.